Hello everyone, welcome to the clinical case presentation from this week. We have a 3-year-old female spay Maltese Terrier presented with 2-week history of intermittent yelping and 2 days progressive history of the following clinical signs. So what we can see when we evaluate the part of the neurological examination, the observation, there is what considered a normal mental status. There is very, very mild to non-voluntary movement on all four. It's very compromised with spontaneous knuckling, increased tone on the pelvic limb. And when we add our hands-on, so part of the neurological examination, we'll see we will do the postural reactions. So there are absent postural reactions on all four, so that's the left pelvic. The spinal reflexes, you can see now the withdrawal reflex is present on all four, but the postural reactions were decreased to absent on all four. And when we do the hopping, it's also decreased, severely decreased, and also on the contralateral limb and the extensor postural thrust, we cannot reach any obvious movement. On manipulation of the cervical spine, there was some reactions on direct palpation. It's probably not, you cannot really hear it from this video, but it did react on manipulation of the cervical area. So we have to summarize the clinical signs. We have a severely non-ambulatory tetraparesis. There were normal spinal reflexes on all four. The cranial nerve evaluation was normal. The mental status was considered normal. Also, although the owner reported that the dog was a little bit quieter and there was cervical hyperesthesia. So we have to make our neurolocalization. What would it be your neurolocalization in this case? And then taking into account the clinical reasoning, think about the possible differential diagnosis. And we will see the outcome on the imaging at the middle of the week and then the outcome of the clinical case by the end of this week. Thank you so much.